Hello, how are you? Today I'm going to tell you what signs your body gives you to show that it is inflamed. Many people suffer from a body that is more inflamed than it should be, and a more inflamed body is linked to a higher likelihood of developing some type of disease and even difficulty losing weight. I'll explain more about this. Stay with me until the end. You won't want to miss it. If you love tips on nutrition, health, and fitness, you're going to love this channel. Take the opportunity to subscribe, turn on the notification bell. I have new videos every day and you're going to love them. Let's start talking a bit more about this issue of inflammation, because we always hear that it's important for you to be less inflamed, that you should consume anti-inflammatory foods. But what is inflammation really? Let's talk more about that. In fact, inflammation is closely related to the process our body uses to defend itself and fight against things that can cause harm. It could be a virus, it could be a bacteria, it could be a cut or a scratch, or even something as subtle as exposure to certain toxins or irritants in the environment. Whenever there is something harmful to your body, it will release certain substances to activate your immune system, to fight against it and try to resolve the situation. This is an acute inflammation. Sometimes you fall, you hurt yourself, or maybe you exercised incorrectly. You might have had an injury in that area, some muscle fibers were torn, some tissue got damaged. You really got hurt, almost like a cut, but on the inside an internal injury. And just like with a surface wound, the same thing happens inside your body, triggering inflammation in that specific area. So this is usually what we call acute inflammation, when you know the cause, and it has a beginning, a middle, and an end. Normally, it gets better after a few days or months. In the case of an infection by a virus or bacteria, it resolves. In the case of a cut, it heals. So, this acute inflammation is important for your body to keep it alive. If you didn't have this inflammatory process, you wouldn't be able to fight off what harms your body. The problem is when this inflammatory mechanism becomes unregulated and overly exaggerated, and this inflammation turns chronic, lasting for months and sometimes even years. This chronic inflammation I'm talking about is inflammation throughout the entire body, a systemic inflammation. It's not just one area that's going to be bothering you, hurting, swollen, and red, like in a traditional inflammation. It's the whole body that's more inflamed. And there are already studies that draw a correlation between a more inflamed environment and the possibility of developing various diseases in the medium and long term, from cancer to stroke. That's why it's important for you to be in as anti-inflammatory an environment as possible. Let's start talking about some signs your body gives that it's inflamed. A major sign that many people who are inflamed experience is fatigue. It's that tiredness where you sleep well, you haven't increased the amount of physical exercise, nothing has really changed in your life, but you still feel very tired all the time, even after sleeping, even after resting. This extreme fatigue can be a sign of inflammation. Another thing is body pain. Many people who are inflamed feel a lot of pain. It can be in a specific place, or it can be widespread pain. I even have a video here on the channel talking more about fibromyalgia if you want to know more about that. But it could be a headache, it could be more cramps during your menstrual period. It's someone who is more sensitive to pain and feels pain more intensely. Many people who are inflamed also have a gastrointestinal problem. Often it can be constipation or it can be diarrhea. And this is also related to diet, because sometimes the wrong diet is causing this inflammation in you and is preventing your intestines from working properly, so you end up in that vicious cycle. Intestines don't work well, become more inflamed, intestines don't work well. You don't know which came first, chicken or egg. But if you've been having more diarrhea or constipation than you should lately, if your intestines have changed and your diet hasn't changed that much, it could also be a sign of inflammation. Inflammation can also be related to some change in your weight, even if you're not doing anything to cause it. You might be gaining weight or losing weight. It can affect your metabolism. In addition, inflammation can weaken your immune system, and as a result, you may end up having more persistent infections. That person who is frequently coming down with a virus has a cold, has herpes, or candidiasis. This may be related to a more inflamed body, which becomes more susceptible to infections. There are some things that, as a rule, will always harm you and put you in a more pro-inflammatory environment. So, if you can control, minimize, or eliminate some of these things that I'm going to mention here, some of them you can actually eliminate, you will create a better environment for yourself in terms of systemic inflammation in your body. The first thing is smoking. Smoking is highly pro-inflammatory. It damages cells, DNA, and it activates the inflammation cascade in our body. Interleukin-6, tumor necrosis factor alpha. So, if you smoke, try to quit. I know it can be very difficult for some people, but seek help if you need it, because smoking isn't just bad for inflammation, it's harmful to your entire body, to various systems and organs in our body. If you're worried about gaining weight after quitting smoking, remember that I have a video here on the channel talking more about this. I'll leave it down below in the description for you as well. Excessive alcohol consumption is also linked to a more inflammatory environment because alcohol is a toxin. This toxin is regulated, we can buy it freely, but it's a toxin that inflames our body, overloads our liver and kidneys, and is also highly pro-inflammatory. So, eliminate it as much as possible from your diet and your daily routine. Obesity is also a major risk factor for being in a more inflammatory environment, and a more inflammatory environment makes it harder to lose weight and actually promotes obesity and being overweight. So, trying to lose weight in a healthy way, without stress or extremes, with a balanced and anti-inflammatory diet can definitely help you address the issue of being overweight and obese. And everything that comes with it, not just the aesthetic aspect, but truly your health, quality of life, longevity, and also the issue of inflammation. In addition, chronic stress can be linked to people who are more inflamed. People who are more stressed tend to have lower immunity and may find themselves in a more pro-inflammatory state. So, all of this ends up being a major risk factor. As I mentioned, there are things you can try to manage, such as weight issues and stress, which are a bit more delicate to address in the medium and long term and require more time, but alcohol consumption and smoking are usually easier to seek help for and treat. Of course, I'm not talking about specific cases of addiction where you really need closer help, actual psychological, or even psychiatric support, but if you can abstain from these, it will be better for you. If you think you might have inflammation, obviously you'll need to see your doctor to get a diagnosis. But normally, they run some tests, such as C-reactive protein, which is a blood test, or even in a blood test, they check the erythrocyte sedimentation rate and how long it takes for the red blood cells to settle. These are lab tests that the doctor can order. And based on the rest as well, the clinical examination that the doctor will perform, they will determine whether or not you have inflammation and which treatment to follow. Things that can help you stay in a less inflamed environment. Remember that your diet is closely related to having a less inflamed body. And I have an entire playlist here on the anti-inflammatory diet with lots of great tips that you can put into practice in your daily life, and I'll leave it down below for you. When we talk about inflammation, many people ask about supplements, whether there are recommended supplements. And it's impossible not to mention omega-3 because it is a type of fat that is highly anti-inflammatory. So it can actually go into that inflammation cascade and modify it, making it anti-inflammatory instead of pro-inflammatory. And omega-3 is super interesting. I have a video here where I talk more about it, including its supplementation. But remember that we can also get it through food. Fatty deep sea fish, as well as chia and flaxseed are good precursors. I'll leave some playlists down below with recipes I have using these ingredients for you. In addition, there are some spices and seasonings that can really help in your daily life to follow a more anti-inflammatory diet. Ginger, garlic, and turmeric are powerful natural anti-inflammatories, and they're very easy to add to your meals. I have a video where I talk more specifically about them and playlists here with turmeric and ginger recipes. I'll leave everything down below in the description to help you as well. So, as you already know, as I have explained before, I've mentioned here that the more natural the food is, the less inflamed your body will be. So try to avoid consuming certain processed and ultra-processed foods, especially foods with unhealthy fats, which are pro-inflammatory, like fried foods and trans fats. I have a video here talking about the best and worst oils for cooking. I'll leave it down below in the description for you as well, if you want to know more about this and the best options. Also remember that sugar is a highly inflammatory food, and people often forget this because sugar is present in so many processed food products. I even have a video talking more about how not to be fooled by food labels. I'll leave it down below in the description for you. In addition, those processed meats, salami, bologna, sausage, all of these usually contain compounds that are very inflammatory for our bodies, bad fats, so it's a good idea for you to avoid consuming them as much as possible. I mentioned sugar, but sometimes we forget that white flour, which is highly refined, will also behave in your bloodstream just like sugar, because in the end, it turns into glucose and raises your blood sugar. So you should also avoid consuming all refined carbohydrates as much as possible. Tell me down below if you think you're someone who is more inflamed, or if you think you're not, that you're doing well in an anti-inflammatory environment. Do you heal well? Do you feel energetic throughout the day? What is your healthy routine like? I would love to see your comment. Like the video, because that helps me a lot. And share it with someone who will enjoy it, with someone who needs it. Let's work together to expand this chain of good, because that's what I want here with the channel. See you next time. Bye.